Hi everyone, and welcome to our video on Veteran Administration and Tricare Mental Health. My name is Instructor Oliver, and today we're going to discuss what is covered, what services are covered within these two programs. So let's get started. The VA and mental health, calling out the big three. So what is the big three? The big three are the three types of medical conditions that are mostly treated by the VA's mental health system. These three conditions would be PTSD, which is post-traumatic stress disorder, depression, and veteran suicide prevention. Okay, so we're going to talk about PTSD first. So the services that are covered by the VA across, I want to say, based on research, across 200 facility treatment programs across the country are that they offer one-to-one mental health assessment and testing to figure out if the individual does suffer from PTSD. They provide medicine that has been proven to work for treatment of PTSD. They provide one-to-one psychotherapy, which is also called talk therapy. This type of therapy includes methods like cognitive processing therapy. They include one-to-one family therapy, group therapy for special needs like anger or stress management, or just supportive therapy when an individual has been in the combat zone. They offer group therapy for vets who have served in certain combat zones or who have been through similar traumas. They also offer treatment and support in other forms, right? So they also would make benefits available to the veterans who can actually go and see a PTSD specialist regularly as an outpatient patient, right? As an outpatient care to veterans with PTSD in each of the VA medical centers across the United States. They are entitled to receive special residential live-in or inpatient care programs. These are found also in each of the regions of the United States. And this helps veterans with severe PTSD symptoms who have trouble doing normal daily activities. Some of those activities could be going to work, just simple functioning. Um, they can also they also offer added PTSD care through their providers in some of their larger community-based outpatient clinics. Okay. The second medical condition that the VA assists with is depression treatment for veterans, right? So depression is a serious illness, but is a mental health problem that is highly treatable. So what they offer is the type of treatments that the VA offers is medicine that is proven to treat depression, anxiety, sleep issues, and other related problems. They also provide psychotherapy, again, the talk therapy, to help treat the depression. These sessions can include learning new behaviors. Um, they can they can include exercise and relaxation methodologies. It'll help them with resolving relationship problems and other things, right? So they focus on different areas. And the third big thing, big medical condition for the vets that the vets help with, the VA helps with, is suicide prevention. So basically, a vet in a mental health crisis, or if they're thinking about hurting themselves, can seek out this treatment, and they will have 24-hour assistance if they reach out to the VA. They can receive ongoing support through the VA healthcare facilities or regional offices. They can speak to a trained suicide prevention coordinator, or they can visit a center for free, and the family can as well, to receive treatment and to discuss their issues. The VA covers a variety of mental health and behavioral treatments. We touched on the big three for them. Right now, we're going to look at the covered services that Tricare provides for mental health. And on the screen, on the slide, you'll see just a handful of treatment programs and therapies that are available to military personnel. But we're going to go over a very quick list of other medically and psychologically mental health benefits that they are entitled to. Okay, so in this case, it would include both inpatient and outpatient care for applied behavior analysis. They offer autism spectrum disorder care, cognitive rehabilitation therapy, collateral visits, drug testing, eating disorder treatment, electroconvulsive therapy, family therapies, gender dysphoria, intensive outpatient programs, inpatient hospital services, management of withdrawal symptoms, medication assisted treatment, office based opioid treatment programs, partial hospitalization, psychoanalysis, psychological testing, psychotherapy, psychotropic drugs, residential treatment facility care, substance use disorder treatment, therapeutic services, and transcranial magnetic stimulation. So, what qualifies an individual for a mental health emergency? Well, we're going to review a few things here. So, what would qualify a patient for a mental health emergency would be if they are at an immediate risk of serious harm to themselves or they pose themselves as a risk to others as a result of the mental disorder. They need immediate, continuous skilled observation at an acute care level based on a psychiatric evaluation. So those two things would be considered when looking at whether or not a person is suffering from a mental health emergency. Now, there are non-emergency mental health care as well that is also covered, right? So when it comes to those, you don't need a referral or prior authorization for any outpatient mental health except for psychoanalysis um, and substance use disorder care. Okay, so services like therapy and counseling, you would not need a referral for. If the individual chooses a provider outside of the network, they may have to pay a higher cost. Okay, so for psychoanalysis or care from an institutional provided outside of a military hospital or clinic, they must have a referral for a non-emergency mental health and substance use disorder care. This concludes our video. Thank you so much for listening in. I hope it was informative. Have a great day.